I'm Cindy, and I'm gonna be presenting my paper titled Decrease of Skin Hydration Levels Within 24 Hours After Chemical Peeling with 30% Salicylic Acid. So, chemical peeling was listed as one of the top 5 non-surgical aesthetic procedures done in the US in 2016, with more than 600,000 procedures a year. It derives from the word chemical and peeling from the word to peel, which means to remove a certain layer. It can be done either physically or chemically. So chemical peeling literally means to remove a certain layer of the skin using chemical substances. The principle of chemical peeling, or sometimes called chemoexfoliation, is to induce a controlled and manageable chemical injury to the epidermis and dermis layers of the skin, which aims to repair the surface texture. One of the chemical agents frequently used for chemical peeling is salicylic acid. Here is the chemical structure on the left, and it is lipophilic in nature, which helps as it penetrates better in oily skin. It also has the anti-inflammatory and antimicrobial properties that makes this acid suitable in treating acne. Salicylic acid peel is widely used because of its favorable effects. It is good for treating acne, pigmented lesions, and mild to moderate photo damage. It is also quite well tolerated in most patients because it works superficially. However, although the side effects are mild and temporary, many patients complain of skin dryness resulted from this peel. In a study by Kim in 2016, among 35 Korean subjects who underwent salicylic acid peeling sessions, 32.3% reported skin dehydration, which returned to normal in 2 weeks. In that study, skin condition was analyzed only 2 weeks after the procedure, which might not show any differences in the hydration level because the skin recovers already, while patients actually reported the skin dryness in the first few days of the procedure. So, in the study, the skin hydration levels was measured within 24 hours after procedure to see if there was any immediate dryness effect before the skin started recovering and went back to normal. This experimental study was an analytical comparative one. The main material used is salicylic acid. When used as a chemical peeling agent, salicylic acid is usually available at the concentration of 10 to 30%, and to get the maximum result, 30% of SA is used in the study. The procedure starts with cleansing, removing the dirt and oil from the whole face using non-alcohol cleanser. Then after the skin is clean and dry, the 30% salicylic acid peel is spread evenly on the face, avoiding sensitive area near the eyes and corner of the nose. It will be applied in 2 layers, one after another, using cotton bud, and the peel is left on the skin for 5 minutes before being neutralized with the alkaline post-peel spray and cleansed using water and dry towel. The skin hydration levels was measured twice throughout the experiment. First measurement is done right after cleansing on the clean and dry skin. Second measurement is done 5 minutes after the peeling is neutralized to see if there is any effect that comes up soon after procedure, and final measurement is done approximately 24 hours after the procedure. All measurements were done within 24 hours because patients often reported skin dryness within this period of time, and that condition tends to get back to normal within a few days. This is the Fitzpatrick skin classification, which focuses on skin reaction to the UV ray. It was divided into 6 different types. Type 1 tends to burn easily and never tans, while type 6 never burns and tans profusely. The Fitzpatrick type of skin included in the study was limited to type 2, 3, and 4 because the 3 types are commonly found in Indonesia, where sun exposure is available adequately throughout the year. Another classification by Baumann, this one it classified the skin into 16 different types based on the criteria dry versus oily, sensitive versus resistant, pigmented versus non-pigmented, and tight versus wrinkled. 36 subjects who meet the criteria were recruited by non-probability purposive sampling technique and were included in the study. The inclusion criteria are women aged 20 to 35 years old, belongs to Fitzpatrick skin type 2, 3, or 4, and agreed to be involved throughout the experiment. On the other hand, anyone with severe acne or is hypersensitive to salicylic acid or is currently having regular vitamin A supplements will be excluded. And the data collected were first analyzed with Shapiro wheel tests to check if they are normally distributed and were later analyzed with paired t-tests to see if they were significantly correlated. The whole data were analyzed using SPSS statistics, version 23, a statistical software from IBM. So a total of 36 subjects were recruited. The majority, 50% of them, belongs to Fitzpatrick skin type 3, 36.1% to Fitzpatrick skin type 4, and the rest, 13.9%, belongs to type 2. As Lim et al. Mentioned in their research, most Asian skin ranges from Fitzpatrick 3 to 4, while people in certain Asian countries like India and Pakistan are dominated with type 4 to 5. And among 16 different types of skin classified by Baumann, there were 10 types of them which appear in the study. It is DRNT, DRPT, DRPW, DSNT, DSNW, DSPT, ORNT, ORPT, ORPW, and OSNT as seen on the chart. And 10 out of 36 subjects were classified as ORNT, which is oily, resistant, non-pigmented, and tight. This is the most common type of skin found in the study. Here are the histograms of skin hydration levels measured before, 5 minutes after, and 24 hours after procedure, labeled P0, P5, and P24. From all 36 subjects acquired, the mean value of skin hydration levels before the salicylic acid peeling procedure is around 38.5%. 5 minutes after the procedure, the mean value becomes 37.242%, and 24 hours after the chemical peeling, it dropped to 36.5%. Notice how the line is steeper between P0 and P5. Next, because the total number of subjects obtained was 36 subjects, the normality test which is suitable for this study is Shapiro wheel test. Normality test is needed to decide which test to be used on the next step. The result of Shapiro wheel test against the collected data shows significance value of 0.101 for P5, 0.244 for P24, and 0.207 for P0. This number indicates that all the data were normally distributed, and the data were then analyzed further using paired t-tests to see if there is any significant correlation between variables. Paired t-test was used to analyze the correlation between two pairings. Here is the first pairing, which is between P0 and P5. The significance value was 0.0, which was less than 0.05, shown in the red circle. And the second pairing is between P0 and P24. The significance value resulted was 0.02, which was less than 0.05. This result concludes that the variables analyzed were significantly correlated. In other words, the skin hydration levels measured 5 minutes and 24 hours post-procedure decreased significantly compared to the level before procedure. So far, there is no clear research on how exactly salicylic acid decreases skin water content and cause dryness after effect yet. This may be resulted from keratolytic properties of salicylic acid, which can solubilize the keratinocyte cell layer on the outer portion of the skin. Damage to the protective barrier of the skin can increase the water evaporation rate, and thus the transepidermal water loss might also increase and skin might become dry. So as the conclusion, there is a 1.99% decrease in skin hydration level before and 24 hours after the chemical peeling procedure, with 30% salicylic acid in women aged 20 to 35 years old with Fitzpatrick phototype 2, 3, and 4. This might happen because of the increase in transepidermal water loss or decrease of sebum production from the sebaceous gland. Following the result of this study, patients with initially dry skin condition are not recommended to take this procedure, as it might further dry up their skin. Also, patients who decided to have chemical peeling with 30% salicylic acid should prepare a moisturizer ointment to be used whenever the skin becomes too dry. That's all for my presentation. Thank you for your attention.